Well, many of you continue to reach out to us with your coronavirus questions, and keep them coming. WBZ's Dr. Malika Marshall has been a trusted source of information for us throughout this pandemic, and she joins me live now. Always good to have you here, Doctor.
Happy to be here.
And we want to get right to the first question. Angela asks, should I get the COVID booster 8 weeks after my second shot, or 8 weeks after it's determined I'm considered fully vaccinated?
Well, you should get a booster 8 months, not 8 weeks after your second shot, if you received either the Moderna or Pfizer vaccine. So that's an important distinction. 8 months versus 8 weeks.
Important. Alan writes, I had COVID in mid-January and received both Pfizer shots by May. Do I need a booster shot?
Yeah, I mean, you should plan on getting a booster shot 8 months after your second Pfizer dose. I mean, even though you've had COVID in the past and may have some immunity built up from that infection, we don't know how much that immunity lasts. We know that immunity from COVID-19 likely wanes over time, as does, of course, immunity from the vaccine. So plan on it.
We know how the size of children factors into medication so often. Bonnie asks on Facebook, as Moderna begins their vaccine trial with children ages 6 to 12, are they basing the dosages on the weight of the child?
So actually, vaccine dosing is not typically based on the weight of a child, but often on how robust the immune system is. Our immune systems weaken with age, so it often takes a smaller dose to stimulate an effective immune response in a young kid compared to a teenager or an adult.
Interesting. Cheryl writes on Facebook, if schools and businesses are going to require proof of vaccination, is that a violation of HIPAA? It is, after all, part of your medical record.
Right. Well, first of all, HIPAA rules really only apply to healthcare providers and insurance companies and things like that who are prohibited from disclosing your personal health information. But HIPAA rules do not typically apply to schools or employers, so they are free to ask about your vaccination status. And of course, for many years, schools have required proof of vaccination for children to enroll. This really is no different, except, of course, we are in an extraordinary public health crisis in which someone's vaccination status can have a direct impact on someone else's health. So get those kids vaccinated.
Always
too.
good to know. Yeah. Thank you, Dr. Malika. And Dr. Malika offers her best advice. As always, consult your personal physician before you make any decisions about your health. If you have a question for Dr. Malika, here are the 3 ways to reach her. Her email, drmalika@cbs.com, on Twitter @Mallika Marshall, or Facebook message her, Dr. Malika Marshall.